Have you seen people whitening their teeth with baking soda, filing them down with nail files, or using rubber bands for braces? Well, today we reveal what actual dentists say about these viral hacks, and it's worse than you think. These so-called experts don't have degrees in dentistry, but are they just sharing harmless tips? Or could these trends damage your mouth for life? Before we get into it, do you know how to spot a credible source of health information? Well, according to Healthline, some red flags include claims that sound too good to be true, websites that end in .com rather than .org or .gov, sites that try to sell you something, and sources that are unbacked by research or experts in the field. So if you see something on the internet, be sure to check the source before you believe it. All right, let's get into it. Hack number 1, filing your teeth with a nail file. Now, you may have seen videos with titles like "Straighten Teeth at Home" or "Get the Perfect Smile in Minutes." They show people using nail files or sandpaper to smooth down their teeth. But here's what dentists warn about this trend. First off, teeth are not like nails, so filing them won't make them look nicer or healthier. In fact, it can do some serious damage to your enamel. If you keep filing and don't stop when you should, you can even hurt the inner part of your tooth, which has nerves and blood vessels. And if that happens, well, it's very hard to fix and might cause permanent injury. Not to mention, this can also flatten your teeth so much that your upper and lower teeth woe and fit together properly. And believe me, that can cause some big problems down the road. It's best to leave teeth filing to your dentist, because once those teeth are filed down, there's no going back. You can't grow new enamel, so you'll be stuck with those changes forever, so don't risk it. Keep your natural smile and visit your dentist for any adjustments or corrections. Hack number 2, whitening your teeth with baking soda and lemon juice. You've probably come across videos claiming that using baking soda and lemon juice, instead of expensive whitening treatments, will save you money and give you a bright smile naturally. But wait, before you grab the baking soda and pucker up, let's hear what dentists have to say about this popular hack. First things first, while baking soda is a household staple and lemon juice is a natural astringent, neither has been scientifically proven to whiten teeth. Plus, doing this can seriously damage your teeth and gums. Here's the deal. Lemon juice is highly acidic, which means it has a pH level below 7. And if you're wondering what pH has to do with whitening your teeth, well, let me explain. Your saliva and tooth enamel have a slightly acidic level around 6.52. 7. Anything more acidic than that can start breaking down the protective layer of your teeth called enamel, which is made up of minerals like calcium and phosphorus. When you whiten your teeth with lemon juice, you're basically bathing your enamel in a substance that's strong enough to dissolve it. Over time, this erosion caused by the low pH level of the lemon juice can make your teeth look yellow. That's because the outer layer of enamel is worn away, revealing the dentin underneath. And the reason you can still see through to the inner part of your tooth, the pulp, is because the remaining enamel is thinner and no longer opaque. In other words, using lemon juice to whiten your teeth is kind of like sanding down a layer of paint on your car to make it look shinier. Sure, it might seem like a quick fix, but in the long run, you're left with thinner, more exposed metal. And in this case, exposed dentin, which is prone to decay and hypersensitivity. So think twice before you squeeze that lemon. There are safe and effective ways to whiten your teeth without causing damage. Now, hack number 3, using rubber bands for DIY braces. Now, you may have seen people online claiming that rubber bands are a quick and easy way to fix gaps between teeth. But wait, before you put a rubber band around your mouth, let's listen to what dentists have to say about this trending hack. First off, rubber bands are not designed for teeth. They're made of latex or rubber, which doesn't play nicely with your mouth. Plus, they're not sterile, which means putting them in your mouth can introduce bacteria and increase the risk of infection. But the biggest problem with using rubber bands as braces is that you have no control over how much force they exert on your teeth, and too much force can cause some serious damage. We're talking about knocking teeth out of place, damaging roots, or even breaking teeth. In the worst cases, it can lead to infections or even tooth loss. Imagine biting into an apple and a tooth just falls out. Not exactly the picture of dental hygiene, right? Instead of risking it all with a rubber band, head to your dentist and talk about options like clear aligners, expanders, or cosmetic bonding. They actually work and won't wreck your mouth. Hack number 4, using hydrogen peroxide as a rinse. Now, you may have come across videos claiming that swishing with hydrogen peroxide kills bacteria. freshens breath and whitens teeth. But wait, before you pour hydrogen peroxide into your mouth, let's hear what dentists have to say about this popular hack. First things first, hydrogen peroxide can be used as a rinse, but only under the guidance of your dentist. You should never use it as a mouthwash on a daily basis. Here's the thing, hydrogen peroxide is a strong oxidizing agent, which means it can kill bacteria and reduce inflammation. However, it can also damage tissues and cause irritation and burning sensations. Think of hydrogen peroxide like a heavy-duty cleaner. It's great for disinfecting surfaces, but you wouldn't want to pour it directly onto your skin, right? Same goes for your mouth. Using hydrogen peroxide as a mouthwash without your dentist's supervision can lead to tissue burns and gum damage. And nobody wants to walk around with a mouthful of sores. So if you're looking to fight bacteria and whiten your teeth, stick to what's formulated for your mouth. Products approved by the American Dental Association and recommended by your dentist are your best bet. And remember, no two mouths are the same. So what works for one person might not work for another. Hack number 5, charcoal toothpaste. Now you may have come across videos claiming that charcoal toothpaste whitens teeth better than regular toothpaste. But wait, before you brush with charcoal, let's hear what dentists have to say about this popular hack. First things first, charcoal is abrasive, which means it can scratch the surface of your teeth. And when your enamel is scratched, it becomes thinner and weaker over time. This makes it easier for bacteria to penetrate your teeth and cause decay. And nobody wants more cavities, right? Plus, there's no scientific evidence proving that charcoal whitens your teeth better than regular fluoride toothpaste. So why risk damaging your enamel for a trend that might not even work? Instead, stick to dentist-approved toothpaste and use a soft bristled toothbrush to brush gently for 2 minutes, twice a day. So why do these hacks go viral? Well, social media is like a giant echo chamber. Something seems convincing, it gets more views and engagement. But here's the kicker. Just because something goes viral doesn't mean it's true or safe. You know how people say, do as I say, not as I do? Well, when it comes to medical advice or hacks, you should do as I say and as I do. Follow credible sources, consult with professionals, and prioritize your health and safety. After all, your health is not a game. It's not a viral trend. It's your life. And you wouldn't want to mess it up for a 15-second hack, would you? If you found this video helpful, give it a thumbs up and share it with others. And don't forget to subscribe for more insightful content. Remember, knowledge is power and sharing is caring. So keep learning, stay healthy, and keep shining that beautiful smile. See you next time.